Good afternoon, everyone. I am Chair Janelle Wilkins. Thank you so much for joining us this afternoon for our briefing on responsible gaming here in Maryland. This is an issue of extreme importance to this committee. We weigh very heavily with every piece of legislation that deals with gaming, the impact that it has on the people in our communities, on their lives, on the issue of gaming responsibly and gambling addiction. And we have throughout the years heard many stories and many individuals giving testimony around the impact of irresponsible gaming and gambling addiction here in our state. And this is something that we want to dig into and will dig into today. It is important to know that this is not a briefing on iGaming or other legislation that is before the Maryland General Assembly. Those bills will be taken up at their bill hearings. And we really want to have an opportunity during this conversation to refresh on our state statutes, make sure that we are connecting with industry leaders around the efforts and steps that are being taken, and understand the numbers as we proceed to continue legislation this session and also in years to come. So I want to thank my colleagues for their presence here. I want to also give gratitude to George Butler, who is our amazing counsel that helped put this briefing together. And with that, we will go ahead and start by bringing up Dr. Christopher Welsh, MD, with the Medical Director and Director of Research, Division of Addiction Treatment and Research in the Maryland Center for Excellence on Problem Gaming.
All right. Can you guys hear me? Okay.
Yes.
This big thing, please do not press. I don't know. Got it.
Yes, okay. You're on.
Great. Well, thanks for having us here. So yeah, I'm Chris Welsh. I'm an addiction psychiatrist, University of Maryland, and the medical director and the director of research for the Maryland Center of Excellence on Problem Gambling. If we have time for questions later, we have several of the other our staff here. But given that we only have a few minutes, we just wanted to focus on, we do a lot of different things there, but one of the bigger things is that we do the legislatively mandated state prevalence study every other year. So just a reminder of what that is. We do it now on the even years. So the last one was we did it in the summer of 2024. It's age 18 and older. So in our report, we refer to that as adult. It gets sent out to tens of thousands of people, but we have this past time about 3,600 people respond. We weight it to cover the different regions and different socio-demographics. These are just some of the other things that we look at. So just real quickly talking about gambling in general, so not problematic. So you see here about 90% of Maryland adults say that they have gambled. Pretty stable over the years we've been doing this survey. This is showing the different types of gambling, 2022 versus 2024. And you see most of them are pretty stable. Some have gone up a little bit, and notably the machines outside of casinos, so like slot machines in bars in certain counties that have those, have gone down a little. But you see there, most of them are fairly stable. When we try to look at problematic gambling, what we use is a screening tool that has been used that's based on the American Psychiatric Association, the criteria we use to diagnose gambling disorder. And the way we use it is, if you see there are different, like depending on how many of the items somebody says yes to, we rate them at low, at risk, problem, or probable pathological. And then when we do the two top ones, the gray ones, when we lump those together and talk about somebody that has problematic gambling. So not all of them would necessarily meet full criteria for a gambling disorder, but they have 3 or 4 things they said yes to. So they're definitely having some issues with gambling. So one of the big take homes from 2024 is that that number, those two top groups there in 2022 was about 4% of Maryland adults. In 2024, it was 5.7%. So, almost 6% of people that were at least having some issues with gambling. Just a little bit of kind of the big picture breakdown of people that have disordered gambling. So you see there 2 to 3 times higher in men than women, which is pretty consistent in any study about gambling. When you read the report, and if you guys, there's like an 80-page report about this on our website if you want all the details, but there are like 2 different ways to look at it. So it gets confusing, but if we look at race and ethnicity, out of the disordered gambling people in the survey, about 36% were white and 52% black. But what we find more useful is to look at the percent of each group that had answered the survey. And that's more of the rate that kind of the percent of people in a given racial ethnic group. So the next one there is the one that we really like to focus on. So about 10% of the black individuals who answered the survey met criteria for the disordered, 3.6% of white, and about 2% Asian. The next one is looking at the age groups. So the age breakdown, the highest group, and again, they're all fairly similar, but about 7.7% of 56 to 64-year-olds met criteria, and you can see the other numbers there. So, it goes down when you get over 75 years old to 3%, but again, we're talking still, large numbers with each group. Just comparing a little bit the 2022 to the 2024, you see there in the bigger, darker number is 2024's. So for the majority of age groups, that it went up in this past. This is breaking it down by race and ethnicity over the last several years. And you see it kind of goes up and down over the years. This is breaking it down by type of gambling and then comparing it to the people who answered the survey but don't meet criteria for disordered gambling. And you see, as you would expect, for almost all types of gambling, people with disordered gambling do it quite a bit more than other adults do. A little bit like bingo, we see non-problematic gamblers have higher rates, but a little bit just looking more at the age breakdown with disordered gambling. So, we have a couple age groups there, 18 to 34, but they're definitely doing more newer forms. We'll talk more about online. The middle age, 35 to 54, a lot more kind of across the different ones, especially casino gambling. You're going to see more in them than the other age groups. Sports betting will, again, looking at that kind of 35 to 54, 70% had ever and 60% had sports gambled in the past year. So a lot more in that age group. Here, breaking down the types of gambling by race and ethnicity. They're all fairly similar in this breakdown here. Lottery, we see more in black than white. But the others, casino gambling a little more in white, games outside a little more, sports betting a little bit more in white. But, those numbers are fairly close to each other. We have more of a breakdown in education, but I just did kind of the simpler college graduate versus not, but we have like high school or less and things like that as well. But you see here, casino more actually with college, a big one, sports, much more, 60% college versus 37 non-college graduates. The others are, as you see, fairly similar. And just to focus, because this is, by far the biggest thing that we're facing now is sports specifically. So we do in the survey, we added last year, and we're going to add, because we're going to do another survey this coming summer, a lot more on online sports gambling. And just a reminder, the asterisk at the bottom, that when we did the last survey, the summer of 2022, we had not started online sports betting in Maryland yet. So that's a big difference between the two surveys. But here, just seeing that, really significant increases between 2022 and 2024 with, all sports betting, but you see the online mobile went up from 12% in 2022 to 44% in, 2024. These, both yearly and daily fantasy went down, which kind of makes sense if you can do all the online otherwise. So just summary of the sports gambling, which again is really a big focus of ours now. So 16.8, and this isn't all problem. This is just totally 16.8% of Maryland adults gambled on sports in the past year. Among Marylanders who had ever gambled on sports, 64% did so in 2024. Again, up a lot from 2022. The daily and fantasy went down. And again, similar to all gambling, but much more in males. We mentioned that kind of middle 25 to 40s, non-Hispanic white. And then just to be aware, we mostly focus on the, that every other year large statewide prevalence study. But another source of data that we have is that we have the 24/7 call center that people can call and ask for help. And we use the 1-800-GAMBLER phone number. When we very first started, we did the call center ourselves, but now we contract with Louisiana that works with about half the states in the country. And they, answer the calls 24/7. You can do phone, text, and chat. You see there, it's about 3/4 are the person with the problem calling, and about 1/4 are a family member or loved one asking for help. And we get data from them every month, and we can look at what they do. So again, I don't know how easily you can see this, but this is just kind of a breakdown. The top is by age. The second one is by racial ethnicity. You see there, it's a similar breakdown with gender, about 60% men, 38% female who call. This is looking at the different types of betting, and as you can see, the light blue is casino, and this is the left hand is the total fiscal year 25, and then the middle one is the last quarter. So we literally just did it for the last quarter of 2025. So you see the big one there. The light blue is casino, the pink is online sports. The darker purple is other types of online, but not sports. So again, it's kind of just another area where we can get data and look at more different groups that we need to be focusing on. And they also, when they talk to somebody who's called, they get which county they're from. So we have some data on which areas in the state we're getting, that the call center is getting more calls from. So you can see there, fairly similar, the areas around DC and central Maryland, but changes from quarter to quarter. So that was, I know, because we didn't have a lot of time. So that was just kind of the big picture. We're happy if you guys want more data. Like I said, all these reports are on our website, the quarterly call center reports, the big prevalence study is on the website. We also have like one-page kind of reviews of a lot of the data, if that would be helpful. So I don't know if we're doing questions now or at the end or.
Yes, we're doing questions now. And thank you so much, Dr. Welsh, for all of your work and the work of the Maryland Center for Excellence on Problem Gaming. We really appreciate the way that you keep us up to speed on data, on trends, so we can make informed decisions and try to protect our residents and our legislation. So thank you. We will go to questions now, and first question is from Delegate Polakovich-Carr.
Thank you, Madam Chair. Thank you so much for the informative presentation. I'm wondering if the prevalence study also includes any information about like the severity of outcomes for folks who have self-identified as having a gambling problem. So like you had a table maybe halfway through that showed kind of which types of gambling folks in the general population versus people who have identified as having a gaming problem participate in. But do we have information on basically maybe like differences in bad outcomes for those folks, for say someone who's participating, like playing lottery games versus going to a casino versus doing online sports betting, for just kind of the negative impacts in their life, say amount of debt or anything like that?
So we have amounts spent. We have data on that. We actually also asked some mental health questions, some physical health questions, employment. Again, there was no way to show you guys all that. But yeah, we do have data on some of the more financial impacts.
I'd be curious to see kind of a summary that ties in with that chart then that you showed there, if that's possible to follow up after this briefing, if that could get shared with the committee.
Okay, sure.
Thank you, Delegate. Let's go to the Vice Chair. Oh.
Thank you, Madam Chair. Thank you for the presentation. And I guess one of the questions, I appreciate Delegate Polakovich-Carr's question, because looking at that chart with the different types of gambling and where the folks with disordered gambling are experiencing that, it would be helpful. I mean, obviously, we have individuals who participate in many types of gambling, right? It would be helpful if there was a way to see this data in a way that reflected individuals, right? Like, so lottery stands out as the highest number by far, right? And it's probably, I'm guessing, the one that has the most individuals who only participate in lottery games and not other forms of gambling. But I'm not sure. That's just an assumption on my part. So if there's some way to show that in terms of number of people impacted and what their multiple forms of gambling might be, is that something you'd be able to provide for us?
We can try and pull, it's hard because right, if somebody does multiple forms of gambling, it's hard to know what the one that's causing them the most problem is. But we have some way, we can definitely look at people that only did one type and not the others. So yeah,
Okay.
we can pull that together.
Okay. And then if I may, Madam Chair, another question just around the helpline. So this is a national number, right? Can you talk a little bit about the call center situation and how that actually works? Like, where do Maryland calls go specifically to a Maryland call center, or
No,
how does that work?
So in Louisiana, there's they started doing this years ago, and over the years, like I said, they now handle almost half the states use this call center. So they're open 24/7, and when the call comes in, a live person answers it. And then they ask the person where they're from, but they use area codes.
Okay.
And so then they've all been trained, and we have meetings with them. And so they have lists of all the resources specifically in Maryland. They have treatment providers in Maryland. We have, if you guys know, we have peer recovery specialists, so people themselves that have had gambling problems that now work in our center, and we have one in the 5 regions of the state. And so the person in Louisiana answering this can offer, I can have this guy who lives in Gary County give you a call. And so it's very specific to Maryland, even though the center doesn't sit in Maryland. They give them resources here in Maryland.
So we provide Maryland-specific resources for the call takers in Louisiana to be able to help individuals from Maryland. How much flexibility do we have in terms of questions asked, in terms of the data that they'll collect for us?
We meet with them every year, and
Okay.
because again, all states want data, so we actually get a ton of data from them. I just
Okay.
showed you a little bit, but
Right.
yeah, we get a lot of data from them every month, types of gambling. And it depends a little bit because when they call, somebody's talking to them, asking them a bunch of questions. If they're texting and chatting,
Okay.
you can't get that same, we can't even get all the demographics from a chat
Okay.
because people just don't want to, that's part of why they're chatting. So, but certainly the people that call, we have a lot more demographics, types of gambling, problems. Sometimes they're calling because they're in crisis, they're suicidal, whatever, so.
And we do have flexibility to change those questions if we want to, or add questions if we want to.
Yeah,
Okay.
we meet with
All right.
them every year and
Thank
kind
you.
of update those.
Okay, thank you. Thank you, Madam Chair.
Thank you, Madam Vice Chair. Delegate Miller.
Thank you, Madam Chair. So I wanted to delve a little bit, thank you for being here in the presentation and all the materials. So with the 60% of college graduates with the sports gambling statistics that you showed, do we have a breakdown of like, are they starting in college? Do we have a breakdown of that? And then we're getting to some of the, with the age restrictions, how do you actually disseminate or get that data?
We do not get the level of, like, when did you start, that kind of thing. Because I'm sure if you guys get these surveys in the mail or like requests on your phone to do a survey, we really have to balance kind of asking a whole bunch of things that would be really nice to know versus what we know somebody's going to be willing to spend 10, 15 minutes to do. So, but we definitely, this coming year, we're going to add to the survey because, for online sports, you have to be 21, and we know there are under 21-year-olds doing it, so we're going to try and get more information on how they're doing it. And, we already know ways that people do it, but here in Maryland, if we can find a little bit more what's happening, and then how can we try and address that?
Will you be working with the University of Maryland system? Yes, because I did notice in the age range of the 18 to 24 age range. Is it possible to work with the college and the University of Maryland system, which has been really receptive to this kind of data on actually what's going on with the students there?
Well, we already now work with, like 20 some of the colleges in the state. They get grants to do different things. So, so the big prevalence study is kind of above the individual colleges, but there are different colleges. I think you're going to hear today from some of the other ones that they are already doing things, and we're working more and more with different ones, including the state system one.
Yeah, I didn't know if that would help with your data collection. And then the last one is in an article that I was reading about, do you get parents calling in for help with their younger 18, relevant, or even younger, I guess, is a possibility because of the easy access to either sports gambling, mobile betting, things like that. Because what I was reading is that there's a shortened timeline for people to develop actually more disordered gambling with either sports gambling or online gambling. Have you seen that in your research, or is there anywhere I can get more information on that?
Yeah, we can definitely get you information, but we're definitely getting more calls. The call center is getting calls, and our peers are getting calls more from parents, like really disturbing, like parents calling saying they just heard from a bookie.
Whoa.
That their
okay.
child owes, tens of thousands of dollars, and what are you going to do about it? And they had no idea this was happening. So, yeah, it's concerning.
That is very concerning. Yes, I would appreciate any more information that you could get me on that. And then, like I said, just the scientific of going more into disordered gambling faster because of that. That would be great. So thank you. Thank you, Madam Chair.
Sure.
Delegate Wims.
Thank you, Madam Chair, and thank you for being here. I just had two quick questions. The first, I just wanted to confirm that what you said earlier, that you said 90% of Marylanders participate in some kind of gambling. Did I get that? So that's
Report that they have ever. Yeah.
okay, that's a high number. Thank you. And then the last question, following up on our Vice Chair, and it's about the Louisiana that you work with them. Could you tell us how much that costs us a year, approximately? If not, you can get it to us offline. Okay, thank you. I got that for the record, 50,000 a year. And then on that, is it possible, or is it worthwhile, you think, instead of talking to them once a year, maybe talking twice a year, because things are moving so quickly? So just a question, or you can get back to
Like
me.
to change questions we ask?
Yes.
Yeah, they're very receptive to us asking to change things, so.
Okay, thank you very much. Thank you, Madam Chair.
Thank you. Delegate Hornberger.
Thank you, Madam Chair. I wanted to speak a little bit more about the fund. So you all, can you tell us how you access money from the fund, and what's the aggregate amount of it? So how are you being reimbursed, or how do you pay for these studies? And
So this is all money that, that goes to the Behavioral Health Administration.
Okay.
And then we have a contract with them, we have since 2012 when the center started. And so every few years, we have a new contract with them, and we have, we present a budget, and we, for the study, I guess you're asking about, that's.
yeah, so just more of the process. The fund, the Problem Gaming Fund exists, and then you all draw money from the fund and to pay for the services?
Yeah, well, we have University of Maryland School of Medicine has a contract with the Behavioral Health Administration of the State Health Department, right?
Yeah, so if you could, because you talked about the peer recovery specialist, which I have a keen interest on, how much of the fund goes towards actual treatment of folks that have identified as having problem gaming?
I'd have to look at the percent, because the way we have it set up is that anyone in Maryland who wants to get treatment can get it covered through the state funds, so.
Because the numbers that I'm looking at on the on the audits that we have is that over 50% of the fund goes towards what I'll call administration, and then less than 50% of the fund actually goes to treat folks that have identified as having a problem gaming addiction. Could you speak to that?
I mean, I'm not exactly sure which fund, because there's more in the problem gambling fund than what comes to our center.
Okay.
So there's a piece that the Behavioral Health Administration, they administer that has nothing to do with what we do. So I'm not sure which
Okay. Well,
number you're looking at.
maybe some of the other speakers might be able to better articulate. Thank you, Madam Chair.
Delegate Polakovich-Carr.
Chair, for the second bite at the apple, but actually Delegate Hornberger just raised a good question. In follow-up, so you said that any Marylander qualifies for free treatment. Is there a wait list? Does anyone get turned away, or does everyone who comes forward get covered currently?
Yeah, there are issues because the way it goes through Maryland Medicaid. So there are issues with Maryland Medicaid sometimes, but it's set up so that if someone, it's really set up more that if somebody does not have insurance, they can get it. But anyone, even if they didn't want to use their insurance, technically could. So. So there's not a waiting list. We have a number. Part of what our center does is trains mental health and addiction specialists out there that don't know a lot about gambling, trains them to be able to treat people with gambling.
Okay, thank you.
Mm-hmm.
And I'll jump in and ask I appreciate how you've listed out the different types of gambling, because I think as we're making decisions, it's important for us to really understand and dig into what's happening in the area that we're looking at. And I think we focus a lot on casinos and sports betting when we think of problem gaming, but the lottery numbers are very, very high. Is there more that you can say about the factors that kind of go into the lottery games, disordered gambling being so high, the type of profile of person that is playing and participating, and just more information around what some of those factors might be?
Well, it's hard, like the question before, just because somebody with disordered gambling does lottery doesn't mean that their big problem might be casino or sports. So, yeah, with the way we do it now, there's no way to really tease out that. But we can look at, are there people that only do lottery? And see if we can tell that there are people, because we do know there are certain groups that the lottery is a huge issue. And we see, unlike, and you see with lottery, it's a lot, we definitely see it in the lower socioeconomic. And so we see it, I'm in Baltimore City, we definitely see a lot of people there that spend a large amount of their, the public assistance they get every month on scratch-offs and other lottery games. So, but we can go through and see how many of the people with disordered only do lottery and look at that separately.
Can you also tell me more about, in terms of the people who are requesting help, whether it's a hotline or other places, do we have information on, have they sort of hit rock bottom? Are they coming in before it gets too late? I'm sure it's a mix, but if you can just say more about the people that are coming in, the types of disorders that we're seeing and what's going on in their lives as they're calling, asking for help.
Yeah, I mean, usually if they haven't hit total bottom, it's pretty bad. I mean, usually something has driven, like something financial or in their relationship has led to them or the loved one calling. People, being arrested, we have people in crisis. I don't know if people, but with problem gambling, suicide, both attempts and completions are higher than pretty much in any other group. So sometimes it's literally somebody who's in an acute crisis that will be reaching out for help. So yeah, it's not usual. Well, occasionally somebody's coming when the problem isn't so bad yet, but usually things have already gotten pretty bad.
Well, of the different interventions, because we definitely want to intervene before it gets to that place. And I know that we are going to hear from other industries where we will learn a little bit more about some of those earlier interventions that we have in place. But is there anything that you can say from your research around tools that you all provide or track that are helping us to intervene earlier before we're at that point?
Yeah, and I think you'll hear from the lottery, but the voluntary exclusion program that the state runs, the different casinos and sports books, the voluntary exclusion things that they run. I think those are some of the biggest things that we have to try and help out earlier. It's hard for us to, because we don't, we find out after, like every year from the lottery, we get the data on the voluntary exclusion. So we can kind of see how many people are in part of it, but it's hard for us to know how many people, by doing that, prevented something worse happening. Mm-hmm. We just don't have that data. But.
Thank you. The Vice Chair.
Thank you, Madam Chair. This is actually just following up on that last response. I guess I'm curious about the voluntary exclusion program because it seems to me that would not be an early intervention kind of step, right? That there has to be some level of healing and awareness before someone joins voluntary exclusion, right? So it's preventative of further gambling, but it's probably someone who's had a problem before they get to the point of voluntary exclusion. Is my understanding correct about how that generally works?
Yeah, I mean, I think the lottery people can tell you more because they often are the ones setting that up. But yeah, usually something. But it could be that a loved one found out when things aren't so bad and said, you need to do something about this. This is something we can do. But yeah, I mean, usually something has already kind of led to anyone kind of getting intervention. A whole nother piece of what our center does is more around prevention. So working with, we already talked about the colleges, we do a lot now with high schools, we do things with even younger kids. So really trying to get in with even earlier prevention things, but.
Okay, thank you, Madam Chair.
Delegate Hornberger.
Thank you, Madam Chair. Wanted to talk a little bit more about the treatment, and you had mentioned about they go into the peer recovery specialist model. Are those folks that they're receiving the training from, because we're dealing with addiction, is it found that in some instances they may have other addictions that may be feeding off of each other? And then do the folks that are administering these services have the ability to treat things that may be triggering, such as opioid, alcohol, and the like?
Yeah, so many of the places where people do get the gambling treatment are in already existing regular addiction treatment programs.
Okay.
So, yeah, so that, and then other mental health providers who may not necessarily do addiction, they also. So, yeah, and we try to help get people, if they need both other addiction and mental health, kind of trying to figure out who is the best match for them.
Okay, thank you.
Delegate Maricopa North.
Thank you, Madam Chair, and thank you for your presentation. I'm looking at page, I guess 17, the helpline self-seeker, gender, age, race, ethnicity, and the graphs make me ask myself, when people are seeking help, is there a language line available for people with multiple languages? Okay.
The Louisiana people have that. Yeah.
Say it again?
The Louisiana call center people have the ability for other languages.
Okay, I just want to make sure I understand. Okay, that was my other question. Thank you.
All right, any other questions for Dr. Welsh? All right, seeing no questions, thank you so much again for your time and your presentation. I'll keep us moving along. Next, we will hear from higher education representatives on problem gambling research. Can we please have Dr. Muhammad? And Dr. Muhammad, when you come up, you can pronounce your name for me. I want to make sure I get it right. Dr. Iona Harrison, Dr. Ali Emdad, and Dr. Don Terry Veal.
Good.
And I think we'll start with Dr. Muhammad when you're ready.
Good morning, Chair Wilkins, Vice Chair Thirdmark, and members of the committee. My name is Dr. Muhammad Jarjouri. That's how I pronounce it. These are silent. I'm the newly appointed Dean of the College of Business at Bowie State University, the oldest HBCU in the state of Maryland, and in the top 5 public HBCUs in the U.S. So with me today is Dr. Harrison, Director of the Center for Business Analytics, for the Center for Data Analytics. Thank you for the opportunity to present today. Our President Bro is in Baltimore for the CIA tournament and sends her regards. So what I'm going to do is briefly, for me, I just want to give you a very brief overview of our center, and then I will turn it over to my colleague, Dr. Harrison, to share with you the preliminary results of her study about gambling behavior. So if you can go to the first one. So the university actually continues to to strongly support the center. And the Center for Data Analytics was established through the Maryland state legislation, HB 0940, that formally designated Boise State as a key institutional partner in supporting research, analysis, and evaluation related to gambling and sports. So the CDA served as a university-wide hub for applied analytics, research, translation, workforce development, and community engagement. It was established in 2023, which is very recent, so we're still trying to build the capacity within the university, and it's a central hub for data analytics for us. It's staffed by a director, administrative assistant, and a lab manager. Next time. Okay. So the main mission for us is twofold. First, within the college, within the university, to equip students with analytics, data analytics skills, and provide the faculty members with the research capacity. And then we work with the community too, as a center for knowledge center for data analytics. Go to the next one. So these are some just simple main achievements of the center. One of them is just happened last year, this Law of Mental Health Summit, which is closely related to this topic. And we have a state procurement HB MOU. And then we also have a DART lab that was sponsored by Truist Bank. So I'm going to turn it over to the director of the Center for Data Analytics, Dr. Harrison, to share with you the preliminary results of the center's research on gambling behavior. Thank you.
And just checking, can you all hear me fine? Okay, great. So what we know about gambling behavior is really informed by two separate surveys, and one of them you just recently heard a great deal about, so that's the Maryland Gambling Prevalence Survey. The other one, I'm glad to hear a question come up about what we know about the colleges, is from the Maryland College Alcohol Survey. Now, this is funded by the Behavioral Health Administration of the Maryland Health Department of Health, excuse me, and it really is a collaborative.
Sorry, can we have you speak into the mic a little bit
sorry,
more?
I wasn't sure. I'll lean forward.
Okay.
I'm tall, so my knees are hitting stuff, y'all. So that's better? Okay. So the survey itself is a part of the Maryland Collaborative, and that's 19 different colleges who are taking part in this, and you can see these are the colleges here. So all of these colleges and universities are a part of the survey, and you may ask, why is it the alcohol survey that's informing our understanding on gambling behavior in Maryland? In the last 3 years, we added questions about gambling behaviors, frequency, you name it, understanding that problem gambling especially is comorbid with a lot of other risky behaviors. So that's how it ended up being a part of this. So what we know is informed by that. So quickly before I jump into that survey itself, I wanted to talk about the shared patterns that we're seeing across the adult survey that was recently talked about and then this college survey. So with age, you saw that problem gambling, the second, I believe, highest group were young people. Those were people between the ages of 18 and 24. Our survey is for undergraduate students between the ages of 18 and 25. So we do know that young adults consistently show these elevated engagement levels. With gender across the board, it doesn't matter what type or mode of gambling. Males participate at much higher rates than our females. And then when it comes to race, problem gambling disproportionately affects our racial and ethnic minority groups. So we see it being a significantly higher proportion of our Black and African American group who are suffering from problem gambling. I talked about this a little bit earlier about it being a part of the alcohol survey, is that the problem gambling is strongly associated with risky behaviors and other adverse behaviors as well. If you think about substance misuse, risky financial activity, as well as elevated symptoms of anxiety and depression. So those who fall into these categories also often are those who are struggling with problem gambling. So I'm going to jump into the survey a little bit more, and these are results from 2025, and you see we have about 2,600 participants in this survey, and if you look at the top, you see the bubbles, but underneath you'll see there's a breakdown by gender. So across these colleges that participated, the 19 colleges, there is about a little over of a quarter of our students who are participating in any gambling or betting in the past 12 months. When we look at this is the breakdown of gender below. When we look at that breakdown, if we were to talk about our male population only, it would be 41% of our men on campus are participating in some gambling or betting in the past 12 months. When we break it down and look at the difference or the type of gambling, when it comes to sports gambling, we have about 12% of our students participating in the last 12 months. And then non-sports, we have about 23% who are participating. Now, I do want to speak a little bit more about the sports gambling because although it is lower than the overall gambling, it has significantly increased in a short amount of time. So if you look at the 12%, you'll see that that is up from 6% in 2024. So in 1 year, we see that that jumped from 6% to 12%. It doubled. And we know, and we expect this to increase over time. We know that other states, once sports gambling was enacted, put into legislation, that it slowly rose. And then we also want to keep an eye on this as it's our young people across our campuses. For BSU itself, or Bowie State, we also have if you look at the two bubbles on the side, our gambling, is on par with what we see in the aggregate results, about 25%. And then when it comes to sports betting, we're a little bit higher. And we've been working, our Alcohol, Tobacco, and Other Drug Prevention Center on campus has been working with the center, the Maryland Center of Excellence on Problem Gambling, to show up and do some prevention activities on campus. You can see what they are here. And I wanted to jump back really quickly to talk about what we know and what we're trying to do with more information we're trying to glean. As it's only been a part of the survey for the last couple of years, we've been working with trying to get, our response rate up. So it used to be that the survey was administered every year, but now it's going to be bi-yearly or biannually, however you like to say that. And that's because there was another survey happening at the same time, surveying college students, and we didn't want that response rate fatigue and also that competition. So we're hoping to even see more folks answering this survey. Also, a little bit more about these modes of gambling. When it comes to sports gambling itself, we know that the most popular modes are year-long fantasy sports betting, weekly and daily fantasy sports betting, and then those mobile apps. And when it comes to the non-sports gambling, it's overwhelmingly, lottery and then in-person casino play. So just giving some more information about that. So there are inherently knowledge gaps in what we know, but I want to talk about where those gaps are and then opportunities to move forward. So as it pertains to what we can say with the surveys we have, although the surveys are critical, they are limited. Our findings are based on self-reported behavior. So it's one, we have to, have folks answer the survey, and then two, we have to have folks honestly report their behavior, their losses, their frequency of play. And we know that stigma, especially around problem gambling, is going to suppress that disclosure. Even if you don't have problem gambling, people understand that may be something that folks are not going to look at them well about. So we don't have that information as accurately as we possibly can have it, but we do know with getting access to more data, we can say more. So a big thing about what we know is survey data is going to tell us what people are willing to report, and then the platform data is going to tell us what's actually happening. So what we fear is that although we're gaining a better understanding of what's happening from a gambling behavior standpoint, is that we are not going to know about the severity of high gamblers, like what does that look like, the financial distress of individuals, and then which residents are at the highest risk because of this bias of non-response or the bias of not reporting accurately on your behavior. A lot of the work we do, you heard from Dean Jajuri, is that community engagement is really important to the Center for Data Analytics at Bowie State University. And what we've been doing now with our campus community as well as our local community in Prince George's County is working with them to better understand how we can apply context and lived experience to the data that we do see. So how is it that we can work with community to better fill in those gaps? How can we work with community to not only fill in the gaps, but build some programs and services that are going to be co-design, those services and programs that are going to resonate better with community, as well as really tackle some of these issues head on. So a lot of the work that we're doing in the in-between and trying to get the information from the platforms and the sports betting agencies is working with community to do that. So we really do think that if we can get working with the data we have, working with community, and then eventually getting access to the platform data, what we really can do is make Maryland innovator when it comes to gaming, responsible gaming strategies. So we're doing that at the local level, but we're also hoping to get access to more data so we can say things much more accurately, much more pointed. So we did have a short amount of time, and then we did want to take it all up. If you have questions for us, we can definitely answer them now. We want to thank you for the time and attention that you've given us in this short amount, in this moment. We can follow up later, or if you have questions, we're happy to answer them. Thank y'all.
Thank you.
Thank you so much. I just want to check, are we hearing from all of you? And is Dr. Veal, did I see you walk in? Are you presenting? They're covering it? Okay. Wonderful. Well, we appreciate the presentation. There were a lot of questions before around universities and campuses, so this is extremely helpful. Delegate Miller.
Thank you, Madam Chair. Yeah, and just to kind of follow up, thank you for the presentation. I really appreciated it in reference especially to my previous question. Can you explain a little bit about, like, have you delved into the lottery piece of it? How are they accessing, like, what type of lottery are we accessing when you're asking some of these questions on the survey? Like, can you explain a little more about that?
No, and thank you for bringing that up, because I did say we have 18 to 25-year-olds. So how are those, especially those 18-year-olds, getting access to these platforms? We are working on, right now, what we're doing is building up the questions that are going to be follow-up added to the survey, the Maryland College Alcohol Survey, and then also working with our own campus community, the ATI, the Alcohol, Tobacco, and Other Drug Prevention Center, working with them with their prevention efforts. What does it look like for us to be in the room and have questions that we can glean and ask the students to really answer that question for us? So we're working on building up some survey data collection tools to do that.
Okay, that sounds good. And then I was looking at, so NCAA has identified gambling by athletes as a major threat to the integrity of intercollegiate athletics, and they're actually coming out with a comprehensive education program, and that athletes and students who are sports fans tend to gamble more than other students. Are you focused on that piece at all as well?
Absolutely. Again, great questions, very tied to some of the work that we're building up now. So they're a particular group that we're going to have a special focus group with, really trying to understand. Of course, we don't want to ask them straight up, to their face, what are you doing? But what are your friends doing? What do you know? What is happening around you? What do you expect? Really filling in that blank for context. So they're a special group that we're having focus groups with.
Okay, good. And then last question is, with parents and families especially, I was just having some conversation about, are you talking to them about what some of the risk signs that would be in a student, and then are there guardrails around? When I used to get my student aid, you come in and you get a big check and they sign that check over to you first, a very large chunk of money, I imagine now. Are there guardrails around that piece of it? We had heard last year, I think, about how that money was getting gambled away, their housing money or their tuition, things like that.
We have not included them yet. We are working with Dr. Ramos, is our director for the ATI Prevention Center, but that's something I'm writing down now, because that definitely, how can we embed that into the prevention where we're educating, again, community beyond our students.
Right, because parents or families might not pick up that, why am I getting some weird requests or for money or things like that? Or why do you need that much for food? How much are you going to whatever, Chipotle or whatever restaurant it is? So, yeah, I mean, University of Maryland, they got some good restaurants there, but come on. So, but anyway, thank you very much. Thank you for being here.
Absolutely, thank you for the invite.
Thank you so much. And Dr. Mdad, will you be presenting?
Yes.
Okay, please.
Yes, Madam
please
Chair.
Go ahead.
Thank you.
And while we're setting up that presentation, we have a question from Delegate Patterson. So if you can stay up, please. And if you can, yes, the two presenters that just sat down, you can stay up, and Delegate Patterson has a question.
Well, thank you very much, Madam Chair. In looking at the demographics, I did not hear anything. Let me find out if there was any disaggregation amongst the problem in particular at the colleges, among students who are identified as athletes or persons who are identified as being part of the military?
No, we don't have that. Military and athletes, you said, you named?
Excuse me? That was not part of the disaggregation?
No, they didn't disaggregate there. When it broke it down by college, certain cells were too small, but we can try to see what we can get access to.
That would be very interesting, particularly amongst the students who identify as athletes. Thank you.
Oh, athletes and military, of course.
Thank you, Delegate. Okay, you can go ahead and begin whenever you're ready.
Madam Vice Chair, thank you. Members of the committee, we appreciate this opportunity to be here and present on behalf of the Center for Data Analytics and Sports Gaming Research at Morgan State. We thank for this opportunity. Briefly, we were asked to present on data related to the nature of gambling and also understand the demographics. So we have some data that we collected from our own research in the center. And I want to mention that the center was created in 2022. We have been functioning with 8 members, and our mission really is to provide independent, data-driven research to help policymakers understand some of the problems, risks associated with with the sports gambling and also general online betting, and also support the development of various policies using the data-driven research that we do. In this presentation, we talk about, next slide, how tools are used in one area of responsible gaming that we addressed, and that's self-exclusion. We want to discuss the research that the Maryland Center of Excellence has done, but because they have already presented on many of the aspects, I'm going to make that presentation brief and move on to some of the findings. Casino gambling seems to be often the high risk linked to the long sessions and continuous play. Online sports are linked to in-play betting, frequency of engagement, and also the mobile access in the internet gambling arena is another issue that we have looked at. Risk correlates with frequency and continuity, not just format. In the demographics, majority of the individuals are male and in the age group between 25 and 44. This group is financially active, digitally engaged, and higher exposure to opportunity. So risk often aligns with economic participation and access. Next. We did, in the center, we conducted a study about 6 months ago, and we just finished it. We're getting ready for journal publication, so we have some data that the most important aspect of it is I'm going to just highlight in here, which is we had 832 participants that were part of the self-exclusion study. A quarter of them breached self-exclusion, and we studied, we understood, tried to understand what the reasons were. And we identified behavioral factors rather than demographics. The behavioral factors outweighed the demographics in terms of behavioral drivers. We identified impulsivity, habit loops, emotional decision-making, and reward sensitivity that made them rebound. In terms of effectiveness of self-exclusion, if it's centralized, it is more effective. And Maryland, fortunately, is one of those states that has the centralized self-exclusion system. About 16 states are within that category. With the fragmented systems, the problem is that it's going to be easy to allow re-entry for the participants. Another responsible gaming aspect we want to highlight in here is that it's shaped, it's formed heavily by behavioral factors. People interact with opportunity, stress response, urge-driven play, loss chasing, and time distortion. These are the factors that are in existence. So effective response requires prevention, support, and structural tools like self-exclusion. Now, these are all voluntary and requires individuals to be able to make decisions when they're calm. But often breaches happen during high emotion periods, and layered systems, we notice that they reduce that risk. I want to point out in here that the center's research can be strengthened through access to anonymized operator data and additional resources, obviously, to build predictive models that improve understanding and help with the behavioral risk and inform responsible gaming policy. We've done extensive research in the responsible gaming area, understanding sentiments in people, how they respond to commercials, for instance, related to sports betting. And all of that is in our latest publication, and I hope that Mr. Butler shared it with the members of the committee. It has the research of all of the data scientists and researchers in the center, and we're hoping that we can continue and expand our research, building the predictive models that would drive legislation. Thank you so much.
Thank you, Dr. Emdad. That was extremely helpful, and that's some of the texture and what I was looking for earlier. So I appreciate you adding that into all of our panelists today that are presenting. Are there any questions for Dr. Emdad or our friends at Bowie State? All right, seeing none, I think that we'll move on to the next panel, although I do want to point out, colleagues, that there are some additional slides in his presentation that I definitely encourage you to look at around self-exclusion and other issues that we may want to take up. So thank you for that.
Sure.
All right. I will bring up our next panel. We'll now hear from our gaming industry representatives on responsible gaming efforts. We'll start with Maryland Lottery. Jasmine Countess, Jennifer Beskid, and Michael Eaton. Please come on up.
Good afternoon, Chair Wilkins, Vice Chair Feldmark, members of the Ways and Means Committee. I'm Jennifer Beskid with the Maryland Lottery and Gaming Control Agency. With me today is Jasmine Countess, our Director of Responsible Gaming, and Michael Eaton, our Director of Gaming. I'm going to have them introduce themselves. Mike?
Good afternoon. Michael Eaton, Managing Director of Gaming at the Maryland Lottery.
And I'm Jasmine Countess, the Responsible Gaming Director at Maryland Lottery and Gaming Control Agency. So today we're going to talk a little bit about the lottery's responsible gaming efforts. And what exactly do we mean by responsible gaming? So these are behaviors or actions that promote safer play. So those who are involved include regulators, they include operators, players, treatment providers, researchers, and more.
Just to make sure everybody understands, the Maryland Lottery and Gaming Control Agency is responsible for both operation and regulation. We operate the Maryland Lottery and we regulate casino gaming and sports wagering in the state. We, of course, were established in state government articles 9, 103, and 104.
So the lottery deploys an extensive responsible gaming strategy across all of our operations. In fact, we do have a team from many different departments with over 75 years of experience in both lottery and gaming, and they work on various initiatives. So this includes how we educate our employees and our lottery retailers, any kind of public awareness campaigns, for example, teaching players how to play responsibly, any kind of product oversight, as well as in general resources that we dedicate in support of responsible gaming. So when I talk about support for responsible gaming, what exactly does that mean from the lottery's perspective? So as you know, the lottery has been around for over 50 years. It came into being in 1972 by voter referendum, and we began operating in 1973. Since then, we've accomplished a lot, and here are some of our highlights. In 2010, we actually founded, and we have been chairing since then, the Maryland Alliance for Responsible Gambling. This alliance is a statewide network of stakeholders. They include some of these people in the room. So gaming operators, us, the Department of Health, the Center of Excellence on Problem Gaming, and also members of the legislature have also participated. So we do information sharing, and we meet on a quarterly basis so that we're not operating in silos, so that we're not becoming isolated from one another. And actually, we just had a meeting earlier in the week. We also achieve and have pursued certifications at both the national and the international level when it comes to responsible gaming. So for example, from 2018 through 2022, we progressed through 4 levels of a certification through an organization called the World Lottery Association. And then last year, on a national level, we also achieved at the highest level a certification where we proved ourselves through our operations as far as responsible gaming goes. So we can stand beside our peers with our best practices, both at a national and an international level. We also do ongoing community outreach. And what this looks like is we may do webinars, for example, like with the Center of Excellence, or we may be at health fairs at like a senior center, for example. And we also employ 2 full-time responsible gaming staff.
Again, as regulators and operators, on the regulation side, when it comes to the ads that you see constantly for casinos and sports wagering, the advertising has to be submitted to our sports wagering and our gaming divisions, and they review and approve to make sure that those ads are consistent with the regulations that have been established. Where the lottery is concerned, we do our own advertising, and our advertising division is excellent in the sense that they pay attention to where they're targeting, where they're placing ads. They make sure that they are looking at markets that are serving those who are 18 and older. They are careful about selecting the broadcast and the streaming markets that they use. They make sure that the advertising is placed appropriately, and all gaming and lottery advertising includes a responsible gaming message.
So when it comes to responsible gaming from an operator point of view, that can include our licensed lottery retailers. They do receive RG training at various standpoints. They also display player education materials. And so we want to normalize conversations around responsible gaming, and we want the players to know that, there is hope and help available. They also display 18 and over messaging as required. And of course, sales and cashing are restricted to those who are over the age of 18. From a lottery player standpoint, responsible gaming looks like some of the following. So we want our players to know the game odds and risks of some of their favorite games. We also want them to know that they can pre-commit before they play a game, and they can establish safeguards around their gaming. And this includes things such as setting budgets or time restrictions. We also want our players to be self-aware and check in with themselves. For example, there are some studies that correlate stress, for example, with problem gaming. So we actually urge our players not to play if they're feeling stressed or distressed in any way. And of course, no matter what happens, there are resources for help. And like I said before, there is hope and help available. So we want to make sure that players know that there are help, that there's resources. And these include the 1-800-GAMBLER helpline. These also include QR codes that are on various materials as well. And we do display resources prominently. And we do advertise responsibly as well, as Jennifer mentioned earlier. For the past 15 years, we have actually operated a voluntary exclusion program whereby a person can choose to exclude from various forms of gambling that we do operate here. So this is available for the lottery as well as casinos and so forth. This is just one tool of many that players can use, and it is not meant to be a substitute for any kind of counseling and treatment. Enrollment is available by appointment at lottery headquarters, or a person can go to any casino 24 hours, 7 days a week with no appointment needed and sign up with Gaming Commission staff. So the Gaming Commission staff does do the intake, and players, they do confirm that they are sober, that they are informed, and knowingly and voluntarily signing up to self-exclude. And for players whose first language is not English, there is translation available via the language line in over 100 languages. As I mentioned before, there are plenty of treatment resources available, which the Maryland Center of Excellence has touched on, and they have been a great partner to us. And lastly, I'd like to remind people, or let you know if you're not aware, that actually March 1st begins Problem Gambling Awareness Month. And so we do take that seriously as an agency, and overall, we do take responsible gaming very seriously. And with that, I'd like to thank you for your time today.
Thank you so much. I'm glad to learn about Problem Gaming Awareness Month, and our committee is ahead of the curve there. Starting next month, we'll definitely keep that in mind, and being able to have this briefing at the end of February is good timing. So thank you for your efforts and your presentation. Any questions? The Vice Chair.
Thank you, Madam Chair. Thank you for the presentation. Really appreciate the information. And my question is actually referring back to the earlier presentation we saw where, and I'm not going to remember the exact number, I think it was maybe 78% of individuals with disordered gambling, that lottery is one of the gambling modalities that they use, right? And I guess I'm curious specifically, two questions. One around advertising, and I appreciate the information you shared, that you're careful not to target anyone under 18. I'm wondering what else informs the sort of advertising and marketing strategies to make sure that you're not targeting folks who have a problem or are at risk of having a problem. And also, with all the great research that we just heard about, sort of what are the connections where that research helps inform your work, and particularly around marketing and advertising?
Thank you for the question, Delegate Feldmark. Would it be all right if I follow up with you after and with the committee after the presentation today?
Sure,
Thank you.
sure. Thank you. Thank you, Madam Chair.
Thank you. And I was just wondering if you have any numbers. Do you all keep and track numbers of people who are participating in the exclusionary program? Following up on that question, because this is many times that we're asking about the gambling addiction specifically to lottery, and how we can get to better understand that, who those individuals are and kind of what is going on. So I think following up on the Vice Chair's question, kind of trying to understand that a little better. And if we're not tracking that or able to track that, I think that's a gap in some of our research between the Maryland Center and the lottery for something for us to try to figure out. So what numbers do you collect, and how can we dig into issues around lottery specifically, with issues of problem gaming, particularly on the types of products, what types of individuals those are, and just trying to really understand that a little bit better.
Thank you for the question, Delegate. So we do publish on a monthly basis data around the self-exclusion programs. There are 5 of them, and so in lottery in particular, I believe as of the end of December, there were about 800 plus people on that list. So that data is out there. We track, for example, gender, states where they're coming from, age ranges, and things of that nature.
I'd also like to add that information Jasmine mentioned is included on our website under our commission meetings on a monthly basis. There are PDFs with that information. Thank you.
Any other questions? Okay, seeing none, thank you so much for your time, and thank you for your presentation and your partnership.
Thank you.
Thank you.
Moving along to the next panels, and just so everyone knows, I am keeping the time on my phone, so we are staying on track with everyone's time limits, and I appreciate that. Thank you. We will bring up MGM National Harbor, Patrick Martin, and Mark Stewart, Executive Vice President and General Counsel for Cordish, as well as Ryan Eller.
Do you want me to? Do you have slides? No slides.
Thank you. Well, good afternoon, Madam Chair, committee members. My name is Patrick Martin. I'm the Vice President of Regional Compliance for MGM. It's a position I've held for the last 8 years. I will confide in you that I was a regulator, 2 different states before coming on with MGM, so in Kansas and Ohio. I think enough time has passed that I can say that we in Kansas and Ohio borrowed heavily from the Maryland Lottery and Gaming Control Agency as far as its regulations, so I don't think I get in trouble for admitting that now, but we have a lot to owe to Maryland for the regulatory frameworks that we had in those other 2 states. I do want to take the first little bit here just to set the table with a quick background on MGM National Harbor, where I'm based, and the other casino operations in the state. First, Maryland's brick and mortar casinos are a significant economic engine. They also create jobs, generate significant tax revenues, and fund important public priorities, including education. Since the creation of the Maryland Education Trust Fund, the state's commercial casinos have contributed $6.1 billion, which is a significant number. MGM National Harbor is the newest casino in the state, opening in 2016. But even with that, giving everyone else the head start, the property has been significant in its funding to the tune of over $1 billion to the Educational Trust Fund. We contribute locally as well. So approximately 47% of our employees are either Prince George's County residents and or veterans, reflecting our dedication to really creating opportunities within the community that we operate. I want to thank you first and foremost for having us here to listening to our piece of the puzzle that you have to solve, and appreciate your time. I'm going to cover really 4 topics today briefly. First, we're going to talk about our purview on that state problem gambling framework. We'll talk about the training that we do for our own employees. We'll talk about how we process people who come forward with problem gambling issues, and we'll talk about increasing RG effectiveness. I will not be touching on any of the prevalence or studies in the state. That's not our wheelhouse. It's not our, just to stay in our lane, to be frank. So we'll stay out of that area, but really appreciate the information from the Maryland Center of Excellence and the lottery itself. To cover that first part, just a refresher on our piece of the problem gambling network and the framework that the state uses to keep out folks who have confided that they have a problem gambling disorder. This is all just one piece of a highly regulated framework that the casinos operate in. Putting aside the Bank Secrecy Act, federal requirements that we do for anti-money laundering, unlike other Maryland businesses, we have a significant number of state regulations that we also have to comply with, and more than 250 of those that cover everything from security, surveillance, cage, which is our bank operations, so the flow of money around the property, slots, table game play, and importantly, responsible gaming. That casino VEP, which I'll say VEP, it's the Voluntary Exclusion Program, but you'll hear me say VEP throughout here. It's a very robust program with, I think, currently around 3,700 folks on that list, so just on the casino list. They have a choice of choosing either a 2-year or a lifetime ban. And that is something that Jasmine, Countess, and her team coordinate. Now, each one of those folks are important. They've come forward and confidentially confided in the state that they have a reason to avoid gambling in Maryland's casinos. When that happens and after her team intakes them, we have a number of duties that we, being responsible operators, need to conduct. That's certainly stopping any kind of marketing to those folks. We don't need to entice them into gambling if they have a problem gambling disorder. 2, we're not going to allow them into our building at all. That includes shows, restaurants, anything that you would want to do at National Harbor. It's not a customer that we're interested in having, so we prohibit them from doing that. 2, if they do happen to show up at one of our properties, all of the casinos in Maryland are required to confiscate any winnings that they have. So think of the slot vouchers, the Tito tickets, the ticket in, ticket out, that is, that a slot machine spits out, or table game chips. So all of that is confiscated and remitted to the state. And last, in some situations, usually on repeat offenders, we will seek criminal trespass charges submitted to the local authorities so that they can handle that as a trespass. Now, for the vast majority of voluntarily excluded patrons, those kind of ramifications matter. It is enough that someone might catch a criminal case by coming into a property that, like I say, for the vast majority of folks, it keeps them out of our casino. But it doesn't mean it prohibits everyone, right? This is a voluntary program. And that's where it's important for us to use not only our personnel, our systems, and a number of processes to help intercept and keep those folks off of our gaming floor. That kind of VEP program, voluntary exclusion program, is standard for all the casinos or all of the jurisdictions that we operate in. And we believe that it's state of the art. What Maryland does here is very similar to what other states do, but it's not everything that we as MGM want to do. So we have added 2 additional layers on top of the state's program that we like to carry out, and we think that helps us a little better at tackling responsible gaming issues. First is what we call our self-limit program. Whenever somebody agrees to come into Maryland and to sign up for that voluntary exclusion program, MGM ends up putting that name and the flags in our database, which is a very large database of all of our players. But we will flag that person's account, again, to show that we're not allowed, that person should not do any financial transactions outside of Maryland. So we're going to export what Maryland has created here, and we're going to say, look, you signed up for the Maryland Voluntary Exclusion Program, but you're at our property in Biloxi, Mississippi. We are not going to allow you to do a number of financial transactions. You essentially become a cash player. So no more credit, no more cash transactions with ATMs, all of those things. And that's a very important additional step that we take. Certainly, those folks are not allowed to, people who are on the self-limit program by virtue of being signed up in a state, also means they don't get to earn any of the complimentaries or things that you hope to earn when you're casino gambling, to get a dinner, a nice dinner, or stay in the hotel or attend a show for free based on your gambling. Those folks are removed from any kind of benefits like that. Now, the same is true for folks who sign up in the bordering states for Maryland, or really any other state that has an exclusion program. MGM and many of the other casinos in Maryland do much the same, with trying to give effect to folks who have come forward in those other states, recognizing that that was a big deal for them to come forward, and that we should be doing something by using our database, again, to make sure that that person who excluded in Pennsylvania similarly becomes a cash-only player in Maryland here. We're not required to do that by law, but we think it makes sense and reflects the severity of folks who have taken that opportunity to come forward and let a state know that they have a problem. We talk now first, so we've got the state program, it's the baseline, we've added on the self-limit. The last component that MGM likes to implement is something called GameSense. GameSense is a forward-looking, or really a customer interaction program that hopes to educate folks across all of our different, whether it's casino or through BetMGM, the digital environments. We want to equip the guests with clear information about how the games work, understand the tools for making different choices, setting budgets, and really making those kinds of conversations the forefront, so that anyone who comes into the property is thinking those things. You know, have I set a budget for today? Am I going to stick to it? Things like that that we want to make sure all of our customers have good information on, and certainly how the games are played. That is critical. Before anybody sits down and starts playing blackjack, you need to know how the game is played. Otherwise, it's a sure loss for you. So if you're going to walk through MGM's National Harbors floor, you're going to see a ton of green pamphlets and signage. These are the GameSense green, and I apologize, I know I wore a green tie today. I'll promise you that that was just an accident. Should have gone with the yellow, but it at least drives home the point that the color and the GameSense is prevalent throughout all of our floor. Last point on that is that it's not just the signs and the pamphlets, that every one of our slot machines, all the approximately 2,300 slot machines that we have on our floor, have information, QR codes that lead people to other information about responsible gaming. So it's a pervasive messaging that, again, supplements the state's program we think is responsible gaming. We have to train our folks. This gets into that second area, the casino training. What are we doing to make sure that our folks know that they're getting the right information? We train not only our people when they're hired, they do annual refreshers, and then we have additional training for folks that become GameSense advisors. We have before included the Maryland Lottery and the MD Center, Maryland Center of Excellence in those trainings. That's an open offer for the committee, any staff that you would like as well. I will skip past that prevalence data as I promised at the outset. Let me skip to the last 2 points, which are the process for identifying problem gambling disorders. So part of our training for our people is to let them know what they're looking for on the floor. And it's typically behaviors. We're not, again, there to diagnose anyone. We're a casino, not treatment providers. But there are some things that we can witness. So making it clear if a patron sounds like they're chasing a loss, if they're neglecting relationships or other responsibilities that they have, if they're experiencing financial stress and they're articulating that to someone, that's a cue that our folks need to step in with the GameSense training they've had, engage with that customer, hopefully break the activity, take them away, you know, hey, can I buy you a cup of coffee and we can go talk about how the house always wins. You're not going to recover your money if you continue gaming. So those are the kinds of things, and certainly making sure that they're aware of all of the services like 1-800-GAMBLER and other things. The last, the effectiveness of RG, I just here want to point out that we have two other, that we provide research. So the $8.5 million I think we've donated since 1997. Just announced yesterday another $1 million as a part of PGAM, Problem Gambling Awareness Month. So some robust controls. And with that, thank you very much, and I'll stand for any questions.
Excuse me.
Thank you, Madam Chair and Madam Vice Chair, Subcommittee Chair Patterson. Mark Stewart with Live Casino and Hotel Maryland and the Cordish Companies. Thank you, Patrick. We touched base prior to our presentation, so I won't be repeating the topics that Patrick went over, but as he indicated, we at Live do many of those take many of those same approaches. He's also, of course, such a pleasant speaker to listen to that it was probably better that he go over it. So, you know, what we strive to do at Live is create an entertaining and fun experience for our guests. And we want our guests to enjoy it safely and responsibly. And clearly, responsible gambling is essential to that. And you can see here our core components. And again, Patrick has touched on it, but we also really focus in on resource education for our guests and promoting the availability of that, on educating and training our employees. Responsible alcohol service is very important because of the ability, you know, how it influences problem gambling. And we too try to go beyond the state required limits, and anybody who voluntarily self-excludes at one of our casinos is excluded from all of our casinos. Taking a different approach of kind of the responsible gambling measures in the casino customer's journey, what we really strive to promote is what I call friction-based gambling or gaming, where there are multiple breaks in the action, decision points for a player to think twice before they make that next bet. They have to get dressed, they have to get up and get out of their house, drive to the casino, get cash, park the car. When they're in the casino, they're then greeted by responsible gambling messaging. They're greeted by security screening, who is looking for underage patrons, or underage persons, I should say, as well as self-excluded patrons. And we have both the in-person check, we have an automated way that we can check those credentials, as well as extensive surveillance. And we have about 125 security personnel at the property, plus additional employees who are not involved in security but are looking for those important aspects of underage gambling and self-exclusion. When you're gambling, you present it, as was mentioned, responsible gambling messaging and QR codes are throughout the facility and on the machines. Anytime that a customer needs to get additional funds, he or she has to essentially have a break in the gaming session to go off the floor and acquire additional funding, which is very different than how things are in the online environment, where there's an e-wallet that's connected to the app and transactions can be completed while the person is in the midst of gambling. We also, as mentioned, we have trained personnel who are serving alcohol, and we're on the lookout for monitoring of alcohol abuse. And really, all of our personnel are there in the casino trained with eyes on the patrons, whether they're dealers, slot attendants, pit managers, supervisors, guest experience personnel, food and beverage. All of these folks are there to try and help ensure that we have responsible gambling. I'll take the chair's admonition not to get into legislation too much, but we did want to say that we applaud the General Assembly and strongly support the bills that are noted. Certainly Delegate Polakovich-Carr's bill has some very important measures in terms of prohibiting credit cards and prohibiting college prop bets or prop bets on college athletes. We are very much in support of multiple measures to crack down on the illegal online gambling market that's out there. Obviously, there's no safeguards in that type of environment, but we believe that enforcement and enhancing enforcement tools is the best way to address that issue. And there's also bills calling for additional prevalence studies targeted to mobile sports betting and that add additional funding for responsible gambling from fantasy and sports betting, and we strongly support that. I know Delegate Miller has a House Bill 1453, which includes those funding pieces and some other measures. But we do believe that there's more that we can do. Dr. Emdad was here earlier. They have a report that has noted that online gambling is more harmful than traditional forms of gambling. Harvard University has said it can be as much as 10 times. We think that, and we would support the General Assembly, and we stand ready to assist in developing additional measures. Some of those are outlined here, and as noted on the slide, they're being considered in states across the country. One is to prohibit in-game betting, it was mentioned earlier, and micro bets, where you're literally betting on each pitch in a baseball game, for instance. That's not really entertainment in our estimation, and it's designed to have patrons bet faster and more money, and that is, frankly, inconsistent and not aligned with the responsible gambling that we espouse. Other measures could include affordability reviews depending on the size of certain deposits, automatic account sign out after a given period of time, multi-factor authentication to try and reduce underage gambling. There's a recent survey out by, I think it's Common Sense Media, that has indicated that 36% of 11 to 17-year-olds are gambling, predominantly on apps. So any measures that we can consider to try and bolster the prevention of these irresponsible gambling aspects would be, we think, very productive. And one in particular, Colorado has recently proposed a bill to prohibit push notifications to gamblers while they're in the apps. These are often devices that do not promote responsible gambling. So with that, I thank you for your time and the opportunity to be part of this important discussion.
Thank you so much. We appreciate the presentations and the information. And we have a question from Delegate Vogel.
Thank you, Madam Chair. Patrick, I really enjoyed hearing about the different protections that are in place for your brick and mortar facilities. I know that MGM also operates MGM Bet, right? The online sports betting and iGaming platform. Do you think that it is that those same considerations, those same protections that are in place at your physical facility, are there equivalent protections in place online on your platforms?
Madam Chair, thank you very much for the question. It's really a lot different. So we have the benefit of seeing people directly gaming to be able to evaluate what their personality is like, what their mood, the concerns that they have. You lose that when you go online. So it's a little bit different having a brick and mortar where we can physically see people in front of us. And not to quibble with you, BetMGM is a joint venture with us, and so it's not part of my reporting structure. They're a separate company, but yeah, fair enough.
Absolutely. So we could assume there are greater concerns around problem gambling on virtual platforms like BetMGM.
Madam Chair, committee member, yeah, I agree that there are different problems. I'm not sure that they're greater, but it's definitely a different.
It's harder to protect against problem gambling, perhaps, on the virtual platforms.
There are things that would be harder. Yeah. There are some things that are a little easier. Like
I asked because I recall in the past MGM being a big proponent of iGaming, and I've had concerns around the potential for problem gambling involving iGaming. So just wanted to ask that question. Thank you.
I appreciate it.
Delegate Patterson.
Thank you, Madam Chair. Thank you very much for the presentation. I have one question regarding the training. I've heard that a lot. And I know that for some of the institutions, there were connections or partnerships with community colleges. And so my question as relates to training for responsible gambling and responsible alcohol service, is it something contractual with one of the post-secondary institutions, or is this in-house?
Subcommittee Chair Patterson and Madam Chair, we contract with outside resources. Typically, it's one of the responsible gambling organizations in a particular state. I know we may also have in-house training, but we do contract with third-party expert providers.
Thank you for the response, but I'm particularly with Prince George's Community College. Was there not a relationship with training at the beginning with MGM?
Madam Chair Delegate, we did have some dealer schools originally to help train folks up on that. We typically avoid doing much interaction with colleges just because our population of guests are 21 and over. We try not to advertise, deal with folks who are under 21. That's different on the lottery side. They have 18 baked in as their law. But for us, we're not interested generally in engaging with, aside from research, we're not generally interested in engaging with the population of college students.
All right, thank you for the clarification.
Madam Chair and Subcommittee Chair Patterson, just to amplify that as far as responsible gaming resources, we have these very robust partnerships with all the resources that the state has to offer. We actually think that many things, as you've heard previously, are best practices that, frankly, we try to emulate, as with our exclusion policy. If we're excluded from one, we're excluded from all, but we're exporting some of the best practices in Maryland. Part of that is our partnerships. In particular, when it comes to alcohol awareness and responsible gaming training, we internalize that as much as possible for two reasons. One, it is something that touches every one of our team members. So every team member, upon orientation as well as on a recurring annual basis, needs certification in both responsible gaming and alcohol awareness. That is something that, frankly, we can't rely upon external parties. We need to internalize that as much as possible. And to the point about those educational institutions, which are community colleges, we are conscious of the fact that there are under 21 there, but of course we can employ those individuals, and they also receive training through our certified curriculum for that purpose, should they work and be employed in the casino. So I just wanted to amplify that a bit, but there's an important reason why we keep that organic to our organization.
All right, thank you very much.
Yes, ma'am.
Any other questions? Okay, seeing none, thank you again for your time.
Thank you.
Okay, our last panel of the day, rounding us out, Joe Maloney, President of the Sports Betting Alliance, and Corey Fox, Senior Vice President of Public Policy and Sustainability at FanDuel.
Good afternoon. I'll go first. My name is Corey Fox, and I'm the Senior Vice President for Public Policy and Sustainability at FanDuel. My role includes oversight of our responsible gaming program, including strategy, compliance, and operations. I'm here today to discuss FanDuel's approach to responsible gaming, the protections for consumers offered by licensed operators, and our commitment to creating a safe, sustainable industry and experience for our customers across all of our products. While the vast majority of our players are able to manage their play responsibly, it is estimated that approximately 1% of U.S. adults meet the criteria for a serious gambling problem, and 2 to 3% experience mild or moderate issues. We take responsible gaming seriously and consider it integral to the long-term sustainability of our company and our industry. Our primary goals with our consumer protection program are promoting awareness of tools and resources, empowering our customers to manage their play, and spreading awareness of the risks of gambling harm. To work towards these goals, our program focuses on 3 key pillars: supporting our customers, furthering a culture of responsible gaming, and uniting the industry. With respect to supporting our customers, we are committed to empowering our customers with industry-leading tools and technology to manage their play. Maryland regulations require operators to provide their users with a robust suite of responsible gaming tools. These include deposit, wager, and time limits that can be customized and set on a daily, weekly, or monthly basis. In addition to those required tools, we also offer deposit alerts and reality checks that notify players when they've spent a certain amount of money or a certain amount of time on the platform. Players can also implement loss limits, which prevent them from placing further wagers once they've lost a specific amount. Over 42% of FanDuel users in Maryland used a responsible gaming tool in 2025. Last year, FanDuel launched a new technology called real-time check-in, which combines deposit data and machine learning to empower customers to manage their play in real time. When a customer makes a deposit that is inconsistent with their normal behavior, real-time check-in prompts them to review their deposit and suggest lowering that amount or potentially setting a deposit limit going forward. We also offer a personalized responsible gaming dashboard called MySpend, designed to help customers track their spending patterns and manage their budget. In January of this year, we announced Play with a Plan, our new research-based messaging aimed at empowering customers to make informed decisions and manage their play proactively. This builds on a successful past year as responsible gaming tool usage increased 41% year over year. FanDuel adheres to Maryland's required self-exclusion program and ingests that list to ensure those individuals cannot wager on our platform or receive direct marketing. In addition to Maryland's program, FanDuel maintains a robust self-exclusion program that can be accessed directly through the app and applies platform-wide across all jurisdictions and products. Upon self-exclusion, we send individuals an email promoting support resources such as gambling blocking software and subsidized mental health resources. Our second pillar is aimed at building a culture of responsible gaming. FanDuel prioritizes consumer education, leveraging our marketing and professional team and league partnerships to increase awareness of risks, best practices, and resources. Through FanDuel's Responsible Gaming Ambassador Program, we work with a team of external partners, including individuals with lived experience of problem gambling. Last year, we launched The Comeback with Craig Carton, a video series sharing stories of problem gambling recovery, with the goal of reducing the stigma relating to problem gambling and highlighting resources for recovery. Through collaboration with two of our other responsible gaming ambassadors, former NBA player Randy Livingston and his wife, sports agent Anita Smith, FanDuel created a program called Trusted Voices, Conversations About Betting. This online resource hub is designed to educate parents, coaches, mentors, and other trusted adults about the risks and warning signs of underage gambling, empowering them to have informed conversations with the young people in their lives. Employee education and internal efforts are also key parts of FanDuel's culture of responsible gaming. All employees are required to take annual responsible gaming trainings, and customer-facing employees take additional trainings to learn to identify and escalate potential signs of problematic play. Our third pillar recognizes that responsible gaming requires industry-wide collaboration, and as the largest online sports betting company in the nation, we are proud to help lead and fund these efforts. FanDuel is an active member of the National Council on Problem Gambling, and in 2025 contributed $150,000 in support of their Agility Grants program. We have also provided grants to the International Center for Responsible Gaming, $150,000 in 2025 as well, for research on gambling disorders and responsible gaming behaviors. Additionally, FanDuel is a founding member of the Responsible Online Gaming Association, ROGA, an independent trade association dedicated to elevating standards for responsible gaming. ROGA was established by some of the largest online operators to promote responsible gaming through research, sharing best practices, and driving consumer education. Finally, I wanted to highlight FanDuel's specific commitment to Maryland and the support we've provided in the state. When we launched our online sportsbook in 2022, FanDuel pledged $1 million to the UNCF for Maryland HBCUs. We're continuing this in 2026 with $60,000 pledged to each of Coppin State and Bowie State. In 2025, FanDuel provided a donation to Maryland's Council on Problem Gambling to support their critical work as well, and we've also worked with the University of Maryland Center of Excellence on Problem Gambling. Through comprehensive customer support, investment in education and awareness, and industry collaboration, we provide the resources and support for Maryland residents who need help and offer tools to preserve the entertainment they enjoy in a safe way. I'll stop there, but happy to answer any questions.
Madam Chair, Vice Chair, committee members, good afternoon. My name is Joe Maloney, President and CEO of the Sports Betting Alliance. Our members, FanDuel, DraftKings, Fanatics, BetMGM, Bet365. operate legal, regulated online sports betting platforms across the United States, including here in Maryland. I'm also proud to call Montgomery County home, where my wife and I are raising our 3 children. Thank you for the opportunity to testify today on responsible gaming. For our companies, responsible gaming is not a box to check. It is the foundation of a sustainable and regulated market. At the same time, we must recognize the reality in Maryland today, a large and growing illegal and unregulated market that's aggressively advertising and targeting Marylanders with online casino games and other online sports betting options. A quick search online produces professional-looking platforms available to anyone. Estimates demonstrate that billions are wagered annually in Maryland on these sites that provide no enforceable consumer protections, no self-exclusion safeguards, and no accountability. Please understand that we must continue to meet this challenge with a durable and sustainable legal regulated market, which in the end is the most powerful disinfectant to the scourge of these companies targeting Marylanders. With that in mind, I'd like to organize our commitment to responsible gaming around 3 key pillars: prevention, proactive protection, and continuous improvement. Prevention. First, we prevent participation by minors and prohibited individuals. Before a single wager is placed, customers must pass rigorous identity verification and geolocation checks. Personal information is cross-checked against public databases to verify age and identity. Accounts are screened against self-exclusion lists. Advanced geolocation tools ensure bets are only placed within state lines. We use multi-factor authentication, device verification, behavioral monitoring to prevent unauthorized access, and help safeguard households. If someone chooses to self-exclude, that decision is binding. They are removed from play and from marketing communications in accordance with state law. These safeguards do not exist in the illegal marketplace. Second pillar, proactive data-driven protection. We proactively empower players using real-time technology. Online platforms allow us to provide tools that traditional environments simply cannot. Every legal operator offers easy-to-use deposit limits, wager limits, loss limits, time limits. Players can initiate cooling off periods or self-exclude for years or permanently, instantly and without friction. Importantly, operators use advanced analytics to monitor for meaningful changes in play, such as unusual spikes in deposits or session length, and can prompt real-time check-ins. These interventions may encourage a player to lower deposit, set a limit, or take a break. AI is strengthening this capacity even further, helping refine risk indicators and tailor interventions earlier and more precisely. We also prominently display 24-hour resources such as 1-800-GAMBLER across platforms and all advertising, ensuring help is visible and accessible. Responsible gaming today is dynamic, data-driven, and constantly evolving. Third, we go above and beyond regulatory minimums and ground our approach in evidence. Our members invest tens of millions of dollars annually in RG programs, research and treatment partnerships. Companies like DraftKings and FanDuel partner with clinical programs and state-run programs to provide access to clinical care for individuals who self-exclude or seek help. These are funded operational programs, not symbolic gestures. It's also important that policy discussions reflect data. Across decades of research in multiple states, the prevalence of severe problem gambling has remained relatively stable, even as legal markets have expanded. This does not mean complacency. Even one Marylander struggling with gambling disorder deserves support and resources. But it does mean policy should strengthen the existing regulated market where protections exist, not drive activity into unregulated environments where they do not. Because the alternative is not less gambling. The alternative is unregulated gambling. So in closing, if I could leave you with 3 clear takeaways. Prevention first. Legal operators use strict verification technology to keep minors and prohibited individuals out. 2, proactive protection. Real-time analytics and AI-driven tools empower players and enable interventions. And 3, continuous improvement. We have to invest heavily and continue to invest heavily in research, clinical partnerships, and evidence-based safeguards that go beyond regulation. Maryland has built a thoughtful regulatory framework, and we are committed to working collaboratively with this committee, Maryland-based regulators, researchers, and advocates to continue raising the standard of responsible gaming. Thank you, and happy to take questions.
Thank you so much for the presentation. Delegate Vogel.
Thank you, Madam Chair. I have a few questions, but I've been quiet over recent weeks, so I hope the committee will indulge me. Corey, if I can start with you, what percentage of the market in sports betting is FanDuel responsible for, approximately?
It varies by how you go, but it's somewhere around 40%.
40-ish percent. So we've been talking for the last hour or so about the rise in sports gambling and problem gambling, in particular amongst youth. Do you consider yourselves to share in some of that, in the responsibility of contributing to that?
We absolutely share in the responsibility in protecting youth from these products. Youth should not be on our site. We have robust Know Your Customer.
But not just youth, across the board, right? There's a rise in problem gambling. You all control approximately 40% of the sports betting market.
Yeah, absolutely. So we do have a responsibility to work in that vein, and that's why when you heard me talk about our responsible gaming ambassadors, we work with Randy Livingston, who's, in addition to being a former NBA player, he's an AAU coach. He works with youngsters and talks to them about these kinds of issues. We've worked with him to create a website at conversationsaboutbetting.com that gives parents the tools they need to have conversations about gambling with youth. So
right, and it's not, again, it's not just youth. It's across the board. We're seeing a rise in problem gambling. And when I say responsibility, I don't mean just responsibility in solving the problem. I consider you all to have some responsibility in creating the problem. But let me go to my.
Well, let me just say briefly. You know, the internet happened, and there's gaming available on the internet because the internet and mobile phones happen, whether we like it or not. And so I think these products will be available to everyone, regardless of whether FanDuel exists. That said, we're an advertiser, we're a licensed entity, and we take this really seriously so that we can do our part.
So I guess on that point, I struggle to understand, and this is a big picture question, and I'll have some more specific questions in a second here. I struggle to understand what incentive you all have to actually address this issue, right? Because the more people are gambling, the more problem gambling exists, the more profit you guys are making. So what incentive do you have to actually address this problem?
Yeah, thank you. That's a really good question and an important one. Look, the reality is there's a finite number of gamblers in the country, and we want our customers to be playing for fun and to play for month over month and year over year. My title is Senior Vice President of Policy and Sustainability. It's that sustainability point. We want to be the leaders, not just today in 2026, but in 2030 and 2035. If players are playing at a level that's not right for them and they burn out, they won't be back. So that's our incentive, to make sure that we're building a sustainable user base.
Got it. So how much money did you all spend on advertising last year?
I don't have that number in front of me.
I think I saw somewhere above $600 million. And, you know, I was reading this story earlier about how folks that watch sports now are complaining about it because you're seeing an ad for sports gambling every 13 seconds approximately during a game. So I guess the question is, do these ads, are you explicitly warning about problem gambling outside of I see the really small disclosure at the end of the ad there, but other than that, are you?
Yeah, so just a month ago, we launched a new responsible gaming focused television commercial called Pause and Play, which is all about taking a pause before you place a wager and encouraging customers to make sure that they're thinking through playing with a plan, which is our new RG focused messaging of, you know, play in a budget, play at the level that's right for you. So we certainly take that responsibility seriously.
And out of the $600 million, how much are you all spending on advertising for that specific ad?
The $600 million was your number, not mine. I don't have those numbers in front of me.
All right. And then, you know, when we talk about these ads, right, they're ads with athletes and kids are seeing these ads on TV as well, right? Do you think that's potentially contributing to a rise in gambling, sports gambling amongst youth?
I think there's a rise in gambling in our culture that, yes, I do think seeing advertising increases that overall rise, but there's so many other things going on with the rise in cryptocurrency and meme stocks and illegal sites and sweep sites. So I think there's a range of opportunities for that kind of behavior across the board.
Right, and I'm almost done, Madam Chair. The answers remind me a bit about the 1990s when the conversation was happening about tobacco and tobacco advertising. And there's a reason why you don't see tobacco ads anymore on TV. Can you tell me a little bit about your algorithms, how they work?
I don't know.
Your advertising algorithms?
I don't know what you mean.
Your marketing. How are you your customers, right? Are there algorithms that you all use to engage your customers?
I'm not sure about algorithms to engage our customers. We certainly target sports fans over the age of 21 as the market who are most likely to enjoy using our products, and we are looking for them across different channels, making sure that those channels are majority filled with those who are 21 plus and sports fans.
Do you push notifications to your customers?
We do have some push notifications.
You do push notifications? Okay. Does your algorithm, to the extent that you know, do you guys target higher frequency and high loss gamblers?
Absolutely not.
There's evidence of that you don't target high frequency and high loss gamblers?
Absolutely, yes, there is evidence.
Can you please share that with me? I'd love to see evidence that that your algorithms don't do that.
Okay.
Okay, great. And then do you use any bonuses or free bets to target or rehook users?
Bonuses are a common practice in the gaming industry, and we do use them, yes.
Okay, and on the issue of push notifications, and for those of you who might not be aware, push notifications are when you get a notification saying that I've posted something to TikTok or Instagram and you should go like it. That's what you get on your phone, those little notifications, Those notifications get folks to come back to the app, right? Again and again and again, right? Maybe you haven't used the app in a while. The algorithm says, hey, Joe hasn't been on the app in a while. Let's push him a notification to his phone so he comes back on the app. There's actually a bill in Colorado that looked to ban those push notifications. And Joe, I think I was reading an article that you actually said the Sports Betting Alliance is opposed to that. I'd love to know why.
Banning push notifications specifically, or the overall bill?
The push notifications.
Well, the push notifications is a relatively easy answer. There are opt-outs that are easily accessible to any and all users. Our app ecosystems, our digital ecosystems, our retail operations, for lack of a better term, exist alongside and are similar to any other sort of retail merchant or any other consumer good. You always have the ability to actually just go right into your iPhone settings and just opt out of any type of push notification. And so
you have to go and you have to opt out yourself.
In most instances, yes. In some other instances,
but
you
the
have
standard
to
is that the app is constantly pushing you to go back on the app, sending you those notifications.
I don't know what the standard is necessarily.
That's the standard if you have to opt out. Those are all my questions. Thank you, Matt.
Can I address that?
Yeah, sure.
The standard is not that they are constantly pushing you in any way. There's a limited number of push notifications that you may receive. I'd also say, even looking at the presentations you've seen here today, the vast majority of our customers play in a healthy way for entertainment, over 90% of them, depending on which numbers you're using, and they enjoy getting those notifications about offers available to them on the site. This is something that they enjoy using.
Thank you so much, Delegate. Delegate Miller.
Thank you, Madam Chair. So I had a couple questions. Thank you all for being here to answer those. So can you just briefly explain your age verification, and is it like the two-factor, or are there any, what are your strategies around the age verification due to, the prevalence of the sports betting among youth?
Sure. So when you sign up for an account, you are required to give your name, address, date of birth, and your social security number. Those pieces of information are then checked against, we use a third-party identity verification supplier who makes sure that you are a real person, you are of age, and you're not on any exclusion lists, and those are the people that are able to play.
Okay, so no pictures, no driver's license, nothing like that?
In some circumstances, that verification method fails and will allow users to upload a driver's license ID, and we've got a different verification service that ensures that that ID is indeed that specific person, and we do allow for that method as well.
Okay, and so, it's interesting because there was a lot of, when we were talking about our longitudinal data study and about some of the authentication they went through, it was very, very interesting. There are a lot more safeguards that you can put in place as far as age verification. Are you not in favor of doing something like that, or are you in favor of doing something like that?
We're absolutely in favor of making sure all of our players are of age. There are different regulations in different jurisdictions, and we comply with the regulations within those jurisdictions. We follow the Maryland regulations here, but we're certainly in support of anything and everything to make sure that our players are of age.
Okay, if you could get me a list of different, what different regulations possibly look like around the country, that would probably be very helpful to give me some perspective. The other piece that was, that I learned today is about the NCAA studies and some of theirs. Do you all do, I don't know a lot about the individual gambling modes, like the prop betting. I know some of my colleagues have much more experience and expertise about this subject. Do you all do the prop betting for colleges?
It varies based on jurisdiction. Different states have different approved betting catalogs, but yes, we do offer it where permitted.
Okay, and do you do play-by-play, game, like what is the extent of it? And again, forgive me if my questions are naive.
Yes, we have all of those.
And has that, my understanding is that's caused a lot of issues and threats to the safety of college players, and some very bad situations for these young students to be in that already have a lot on their shoulders and that face a lot of pressure. And you heard my quote probably earlier about the concerns about the NCAA and even about the integrity of the games going forward. Are you working or partnering with anyone to address some of those very serious concerns?
Yeah, so first of all, I just want to say we condemn any harassment of any athletes, professional or college. In our terms and conditions, it's very clear that if we catch you harassing an athlete, you will be kicked off of our site, and we have done that in some circumstances. There was a publicized incident involving a track and field athlete where we kicked someone off the site just for that reason. So we take that very seriously. In terms of partnering with others, we are talking to all of the leagues and have come up with a process where we work with some of the pro sports leagues where if they mention that an athlete has been harassed, we will go and try to find the individual and see if they're on our site so that we can prohibit them from betting on our site any further.
So do you think it would be better, instead of just condemning it, that you put things in place that would prevent it or that would prevent it down to the player level? Because once these things have already happened, you can have some very tragic consequences quickly.
Prevent what exactly?
To prevent the prop betting on players, to prevent, that's part of your gaming platform that I'm assuming you have control over.
Yeah, I think prop wagering is the way that people enjoy sports wagering in 2026. There's been an evolution of people rooting for teams to players, and people really enjoy wagering on players. Prop wagering is something that exists throughout the betting ecosystem, both in the illegal and the legal market. So I really believe that the right way to address prop betting is to have it regulated in the sunlight in the legal market and to identify the issues through a legal regulated platform.
And then my question is, so do you stay away from advertising at colleges and things like that, as my colleague was talking about the push notifications and everything, due to the overlap of the ages of players that are at schools like that?
So with respect to banner advertising, billboard advertising, anything like that, we would never advertise on a college campus. We have a policy of never doing that. So we stay away from that.
Yeah, I would just say across the Sports Betting Alliance and the 5 member companies, previously, prior to a decision made across 2 different trade organizations that unfortunately caused a sort of a moment in the industry where we're separate at this period in time. We all subscribe to a code of conduct around advertising, and one of those specifically banned university partnerships, NIL partnerships, as well as ensuring, and we can measure this with Nielsen data, that the reasonable expectation of audiences above the age of 21 is 73%. And I would also just note, specifically with respect to advertising, the NCAA, pursuant to the sale of its live media rights, does not permit advertisements from sports betting entities. So the reason why you see sports betting ads across major professional leagues and organizations is because those leagues, those professional leagues, foster official partnerships with legalized sportsbooks and legalized sportsbooks only. Currently, right now in this country, and again, against Nielsen data, which we're happy to provide for you, less than 5% of the commercial load during a major live sports broadcast is sports betting related. For every sports betting ad you see on television, you see 38 pharmaceutical ads. So just to put that in context, and overall, we're less than 1% of the entire commercial load in the United States as an industry.
Thank you for that, and thank you for the answer. I appreciate it, the perspective. Then my last question is, I was a bit taken aback by the comment that parents are getting calls from bookies regarding their children, and it was around our discussion of the timetable and how fast that has now gone as far as into addiction and then into really disease as far as gambling goes, and then the increase in percentages of that. You saw the presentation, especially on the college campuses, and how those issues are doubling. Was that surprising to you? And do you feel any sense of urgency as this problem seems to be escalating on how you can help even further scale it back? I appreciated Live's legislative list that they would be in favor of that we're not even considering yet. So do you have any suggestions or solutions that from your perspective would be helpful?
Yeah, I'd be happy to answer to that. And our submitted written testimony and even verbal testimony spoke a little bit to that. And I speak as a parent of a 9-year-old and 12-year-old who are in the games universe. I've had 2 instances already where I've had to have a conversation with my 9-year-old and with my 12-year-old that you are actually in a gaming environment. You don't realize it, but you're actually wagering. And so when you come back and you say, Dad, I need more virtual currency, that is the dopamine effect. And so, we're absolutely invested in ensuring that we are leveraging evidence-backed solutions that actually strengthen the market, the regulated market that all of you in the state of Maryland have invested so much time in establishing. Because again, the alternative with some of the suggestions thrown around today, in Mr. Stewart's testimony specifically about, this Colorado legislation and some of the other things that we're seeing, the question becomes, are we doing it at the expense of the regulated market? And what risks do we have in potentially allowing the illegal market to repatriate many of the bettors we've successfully migrated out of these illegal and unregulated settings? So we're in the business of working with the committee and folks across the state of Maryland to understand what are evidence-backed solutions that can address some of the concerns here, public health, athlete wellness, or otherwise.
Yeah, and I do feel, and I think a lot of the times with the young children and the games that they're playing and the virtual currency, I feel like they still see this as virtual currency when they're switching from this platform to that platform. And I do think that we are incentivizing them through that. So I appreciate the further ongoing research and conversations about that and how we can prevent it. Thank you, Madam Chair, for the extra time.
Thank you, Delegate. Let's go to the Vice Chair.
Thank you, Madam Chair. Thank you both for the presentations. I have 2 questions. The first deals with the responsible gaming tools, and I was actually really pleasantly surprised to hear that over 42% of FanDuel users actually use the responsible gaming tools. And I couldn't exactly get the percentages to match because that's the percentage of FanDuel users as opposed to percentage of adults, which is where we saw stats in the earlier presentations. But it sounds to me that extends into what would be low-risk gamblers who are, probably having a healthy, responsible gaming, right? Yeah. Is that your assessment, or?
I think that's right. I think our plan is that using a responsible gaming tool and understanding responsible gaming resources is like putting on your seatbelt when you get into a car.
I love that example.
You're not planning on getting into a car accident, but you never know when something's going to happen in your life and you're going to tip over into problem gambling. So if you have a limit in place, a tool in place, you're more likely to be able to control your spending.
So just like we want everyone in every vehicle to wear a seatbelt, instead of just having these tools available for those who go seeking them,
that's right.
Why not have it be the first step every time you log on? Why not set time limits and loss limits every time you log on?
So we think there's quite a bit of research that customer-empowered tools are the tools that work. We're just one platform. There are many other platforms. There are legal sites and illegal sites and all sorts of other places to wager.
Right.
The research that we've seen suggests that when customers set tools for themselves, those are the ones that they keep to.
Okay.
And so we are trying to increase the percentage of our users who use tools. Our parent company has made it so that for every FanDuel employee, part of our personal bonuses at the end of the year are based on our responsible gaming goals as a company. And one of our responsible gaming goals is to increase our responsible gaming tool usage with a goal of 75% of our parent company's users using a tool by 2030.
Okay. Okay. Just something I would love to see considered, to make that actually just part of the process every time. The second question I had was sort of as you were talking about the sort of power of the data you collect and being able to recognize when there's a spike or some sort of, red flag on problem behavior or atypical behavior. And so my question is, how long does it take you to establish what a normal baseline for a particular user is? And so how quickly can you start identifying problems?
It's a really good point, and it varies based on user, and I have to be honest, the science on this is really evolving. There are not clear answers about what is problematic play by looking at their play versus non-problematic play. We have risk scoring tools, and we generally say for our risk scoring tools, you have to have played for at least a week in order for you to be in the algorithm where we're checking to see if you're a high-risk user.
Okay. Okay. All right. Thank you. Thank you, Madam Chair.
Thank you so much, Madam Vice Chair. We'll go to Delegate Ebersol.
It's a natural reaction. This is a quick clarification. You said that you do prop bets on colleges, but not in Maryland, do you?
That's right, because Maryland prohibits them, correct.
Okay, let's just make sure that we're protecting our student athletes from that kind of pressure.
Absolutely.
Okay, thanks.
I do have a question or two, and then we'll close out. I wanted to know from both of you, I have been downloading some of the apps recently to get into the sports betting and really understand how it works. One of the things that I noticed is that to make an initial bet, the different companies seem to have a range of amounts to start off. And I think that that's important because, putting in $20 versus being able to put in, a $10 amount and those lower types of amounts every time you re-up, I think really influences what we were talking about when it comes to adding limits and self-limiting. And to complement FanDuel, I noticed that you actually do have one of the lower amounts in terms of the industries that I've been experimenting with in terms of sports betting. So I just wanted to hear a commentary on that and why there is this range, what goes into the thought around how much the minimum that you're able to re-up, and how you think that might influence the issue of problem gaming.
I think, and if I understand your question, I think what you're probably referring to is the suggested amounts when you go to place a deposit. You can deposit, I believe, as low as $1 onto FanDuel. There are suggested amounts that might be like 1, 5, and 25 or something as your first time deposit, but you can deposit as low as you want to. I think that's probably true on most of the sites, though there are suggested amounts that may be higher than that.
FanDuel allowed that, but not all of them did, and I downloaded a range of them. So maybe you can correct me if I am wrong on that. And I know you were about to respond. So go ahead.
No, I was just also going to say the suggested amount to actually wager after you've placed the deposit can also vary. But, again, anecdotally, as I've gone through the same exercise, I previously worked at the NFL where I wasn't allowed to actually place a wager or download an app or step foot in a casino. However, upon leaving and exiting the NFL, I was able to do this. And I just found that even the suggested wager amount was more than I typically wager. But then I learned that within each of the downloaded apps here in the state of Maryland, you're actually able to adjust the suggested amount to wager. So it's always what is your typically preferred bet as well. So again, within the legal regulated marketplace, there is that ability to even adjust the suggested amount on the wager catalog before you go to actually wager.
So in terms of the variation, I think that there is maybe some work to be done in terms of what we are even suggesting that people put in, because there was that range when I was looking at the different apps, and I'm wondering if you think that has any influence when someone's, it's being suggested. So for example, we do not campaign or do donations during legislative session. However, all of us have levels of suggestions. Of course, anyone can donate any amount, but we're trying to steer someone towards a higher amount in certain levels when we do have campaign events. Most of us do levels. So I think that there is sort of a steering towards a higher level when you have those suggested amounts. And just from the short time that I was in these apps, you're saying that they're suggestions, and I take that and accept that, but it was not super clear when I was looking around in it. So that was the first thing I noticed in order to make a bet, and I just wanted to really explore that because I found that different among the different apps.
We're more than happy to work with both the lottery and the General Assembly on the right way to address that.
Okay, thank you. I also wanted to pick up on Delegate Vogel's questions and commentary, because another observation that I had is that with sports betting, and I guess this is pretty much every app on our phones, right? They want to keep you there. And I noticed that part of the challenge around sports betting and the issue of problem gaming is that it seems the business model is for you to keep betting, stay in the app, bet something, you win, you lose, here comes a notification or a suggestion on another game, here comes some free play to continue to play. Sort of the entire model feels like, and then we talked about the issue of push notifications. So although you mentioned, the exclusions, the limits that someone's able to put, the entire model feels like stay in, keep going. I opened up a couple of apps as we were sitting here just to look. And the moment I open it up, is it Wade Cunningham? So I'm not a sports person. A suggestion on betting on him. There is just, it feels like the entire model is for you to stay and kind of facilitating you having a little bit of that dependence and that consistency in there. So I just wanted you to comment on having a business model that is dependent on people staying and continuing to bet, which is up against us trying to make sure that we address and prevent problem gaming, and your commentary on some of the steps that you are open to in order for us to address this.
Yes, so thank you for the question. I think, one way I think about this was when you think about all of those tools that I described previously, deposit limits, time limits, wager limits, the real-time check-in program that I described, all of that, and you compare that to what exists sort of in the overall e-commerce ecosystem, so whether that's Amazon.com or whether that's Robinhood or whether that's other Bitcoin or other virtual currencies, all sorts of other opportunities to spend money across the internet. I actually think we have the most robust set of tools to manage your play responsibly on regulated online gaming sites as compared to all of that. Last year when I was shopping for an espresso machine, I looked on Amazon for an espresso machine. Ads for espresso machines followed me all over the internet. I got emails about espresso machines, followed me everywhere. Actually, I don't think you see that with online sports gaming. So I do think we have good controls built in addition to, if you want to opt out of marketing entirely, that's also an option on regulated sports sites and on FanDuel. So I do think customers have options to empower them to play the way they want to play, but we are an e-commerce site and we do want people to come and enjoy and have the entertainment experience that they're looking for.
I do understand that, but what I want you to comment on is the fact that the entire premise, it feels, of sports betting in these apps is for people to stay there, continue to be engaged. The promo play, the push notifications, the suggestions on, hey, bet on this, which is sort of the experience. I see why it'd be a fun experience for people who sports bet. Unfortunately, because I don't really understand sports, my limitations in participating are there, but I can see the enjoyment in it. But I want you to comment more on that business model and how that seems very evident and clear how that would link to someone getting very addicted to it, because once you get in the app, there's just a constant ways to keep you in and keep you there.
We do want to have an engaging experience in the app. That is how we compete against our competitors and provide a great experience to our customers who enjoy the app. So I agree with you that we're trying to create a great engaging experience within the app. I'd also say, though, with sports betting, there's a natural time lag to it, because oftentimes you're betting on a game and then the game has to take place. So you wait while the game takes place and get a lot of entertainment for yourself while that game is taking place.
Mm-hmm.
Madam Chair, if I may also, I think another important consideration here is a reflection of, I think, the good work of the state and of the regulated market, is that you've provided an opportunity for competition for those that actually enjoy this entertainment experience. And so in the spirit of actually competing within the legal regulated marketplace, as well as competing against digital storefronts that deploy the same types of products, push notifications and the like, it's serving up appropriate reminders for those consumers who want these types of communications. In this new job that I just started about 2 months ago, I work from home. I live pretty close to several local eating and food establishments that are particularly popular around lunchtime. And so I like push notifications because I don't like paying full price for a salad. So at any given point in the middle of the day, I'm receiving multiple communications around 11 a.m., 11:30, right around the time when I'm hungry. People are competing for my business, and push notifications are a marketing tool to that end. And again, I think this is a reflection of, I think, the vibrant and sort of very competitive legal regulated marketplace, as well as acknowledging that companies such as FanDuel and the other members of the SBA, unfortunately, also have to compete with unregulated operators as well, and illegal operators for that matter. And so push notifications serve as a marketing tool. Consumers, particularly those of age, 21 plus, that are largely doing this, of course, with a digital device, we obviously want to put them in touch with any of all faculties to actually opt out of those. And then again, companies have specific policies to specifically opt out of all marketing as well, which would include email pushes.
Got it. And this will be my last question. I know it's Friday and we've worked very hard this week here in Annapolis. So at what point, so let me give an example. I really enjoy TikTok. I scroll on TikTok. That's in my free time. That's what I enjoy doing and spending time on. I think that, and there's probably research and studies out there around people who are addicted to, different social media sites and things like that. And so my question to you all, for me to understand, I know a lot of my friends who enjoy sports betting, they're spending the season betting every game. They're enjoying themselves. It's a good time on the sports betting apps and betting, let's just say, football season on every game. At what point do you all view the amount of time, the amount of games? When do we move from enjoyment and being constantly on the app into an addiction, and where we intervene? If you can talk more about that.
Yeah, I think that's a really good question, and I'm not sure that I have a completely satisfactory answer to you, to be really honest. But I do think the way we look at it is that the amount of time and the amount of money spent that is problematic really varies by every individual. And that's important on both ends, right? Because for some folks, they might bet $20 and that's an issue for them in their personal budget, whereas many of us are able to spend that $20. And some people might bet much more than that, and that might be comfortable for them in their budget. And the same goes for time. Some people have a lot of family obligations and things that they need to be doing, or jobs that require their attention, and some less so. So it really varies by person. So a lot of our efforts in identifying problematic play are really looking for spikes. So attempting to establish a baseline and then saying this person is moving off of their baseline, this may not be healthy for them. We at the high ends, we are looking for ways to say, okay, this is just too much. And so the challenge is finding the research on that to have really evidence-based approaches to that, which is why we have those investments in the International Center for Responsible Gaming and the Responsible Online Gaming Association, who are conducting studies to try to get better at that point.
So right now, if someone is betting on every game, every football game during the season, or a lot of them, and it's consistent, you may not at this point believe that maybe that there's an addiction, maybe they're just enjoying and participating. And we're not clear yet on what the boundary is into addiction and intervention.
It's going to vary by every individual person, and so it's really a challenge to decide at what point they've gone over.
Okay. Well, thank you so much. I do find the sports betting industry very fascinating, especially after my recent experiments. And I do want to mention, I think what you said earlier about, here is the internet has brought all of these to bear. And when it comes to our phones, I think us just figuring out what is healthy in a number of different areas, and sports betting being one of the more complicated ones because it's unlike the other industries, it's right there on the phone. But we appreciate your partnership. Thank you very much to FanDuel and also to the Sports Betting Alliance for your engagement with us and all of our presenters today. I know it's been a long briefing and a long week, so thank you, colleagues, for sticking through it and for all of the work this week. I'll see everyone on Monday at Floor, and have a great weekend. Thank you.